Here is an instructional video to help you out in these unusual times. Now, leaving braces on for an extended period of time generally has little risks, with the exception of increased risk of white marks on teeth due to plaque being left on the teeth for an extended time. Now, those white marks are completely preventable by keeping our teeth clean. So cleaning is really important in these times of COVID and not being able to manage I'm not being able to manage your orthodontic treatment as per normal. So when we're cleaning our teeth, the important things to remember are getting those bristles underneath the arch wire and down to the gum line. So the areas where people typically miss the plaque, if you zoom in there, it's right underneath the arch wire, so where the tip of that little probe is, so down in that area there and around the gum line. So particularly around these lower incisors, underneath those hooks are where people generally miss brushing their teeth, and up underneath, in both jaws, underneath the arch wire. So the angle of the toothbrush is really, really important. What we do, we get our toothbrush, we angle it 45 degrees, and with firm pressure we push our bristles. You can see it going underneath the arch wire, and we do little motions forward and back. And that's essentially how we're making sure our bristles are going underneath the gum, underneath that arch wire. You should be able to push those bristles all the way to the gum line, and particularly if your gums have come up a little bit closer towards the brackets, you can get in there and actually massage underneath the gum line. Now we then do the same thing going the other direction. So we're getting our lip out of the way, so going down like so, getting our lip out of the way, and then coming back up in that direction. You can see those bristles coming up underneath the arch wire, and we move forward and back, little circular motions. We should feel those bristles touch the gum line. We feel those bristles going up underneath the arch wire. So that's the general technique we use to get around our braces. To make sure we clean every area of our teeth, we start at the back of the mouth. We use that same angulation technique. We go round and round. We do about 5 seconds on each tooth, working on one tooth at a time, and then we come forward by one tooth. We're not doing this. We're not scrubbing like so. We've got our toothbrush in there, angled down like that, and little movements, concentrating on one small area at a time. Now we're going all the way around the mouth in this direction. Now eventually we need to change our hand and hold our toothbrush in a different position. And when we do that, we make sure we come forward. We then change our hand position. It's going to be difficult. And we make sure our toothbrush comes backwards and brushing the area we've just been to, and keep going around the mouth. So to make sure we always have that overlap, to make sure we don't miss any parts of our teeth or any parts of our mouth. So we brushed around the lower jaw coming from the biting surface of the teeth. We now need to go back and do exactly the same pattern, same sort of technique, but going in the reverse direction, coming up underneath the arch wire. So coming up there, we're working on the very back teeth. We're doing 5 seconds on each tooth, slowly coming forward. We're not scrubbing backwards and forwards because you can see those bristles don't go underneath the arch wire. So we're going little forward and back motions like so. Okay, now don't forget, we are going to be brushing the biting surface of the teeth, and we're doing the same technique, but only one direction now. So we're angling down, making sure our bristles touch the gum line, down in there, right around those back teeth, little circular motions, working on one tooth at a time, slowly working our way around the mouth. Our lower front teeth, we can come from the front, do little jiggling motions up and down, making sure our toothbrush touches the gum line, and then we change our toothbrush position, go right to the back of the mouth, angle it down, and small little motions like that, slowly coming forward, making sure we cover all surfaces. So that is the lower jaw, and we repeat the same process for the upper jaw. Now, using a bottle brush is very good for getting up underneath the arch wires, like so. And if you've got crowded teeth, it's very useful for getting in between the teeth. Now we're going down between the teeth, up and down like so, making sure we're getting all areas. We can use our bottle brush for going underneath any hook, and it's also good to come up from the other direction as well. Okay, now people where there's gaps between the teeth, we may be able to put our floss between the teeth. For most young people, that's not possible. For older individuals where the gums have come down a bit, then we floss in between the teeth all the way around the mouth. But for most young people, we can't do that because there's not enough space between the teeth, and so we're going to be using floss. Now floss, as I've said, Australians have lots of time at the moment. They're really spending lots of time at home. To floss takes a long time. I've warned everyone before they start the treatment that they're going to be spending 10 minutes flossing their teeth once a day, every day for the rest of their life. I repeat that many times a day when I'm working. Not so much these days when I haven't been doing much painting yet, but I'll get there eventually. Okay, so sorry, I'll repeat myself. We'll talk through my actions there. So with flossing, we feed the floss underneath the arch wire. Now at the back of the mouth, a small pair of tweezers may help that. We're going to get the floss up in between the teeth. And now, the important thing with flossing is we only have 2 fingers in the mouth at one time. So you can see I've got 2 fingers close to each other, and all the other fingers are out of the mouth. So I've only got my 2 fingers in the mouth. They're nice and close together. I saw backwards and forwards to go down between the teeth. I push the floss backwards and go up and down. I push the floss forward and go up and down. There's a nice little Colgate video on the Colgate website that shows flossing without braces, which gives you an idea of moving that up and down between the teeth. Obviously with braces we need to go underneath the arch wire. So once we've done one space between the teeth, we take the floss out and we go up in between the next set of teeth. Up and down between the teeth, pushing backwards, cleaning the front of that back tooth, pulling forward, cleaning the back of the front tooth, and out again. And we're doing that for every single tooth. Now, by now I should have sent out an email recommending Nutriflor 5000 toothpaste. That's a toothpaste with 5 times the normal amount of fluoride in it compared to the standard Colgate Total. And we should be using that twice a day. This is how we make sure that we avoid our white marks on our teeth. Be careful with acidic drinks, so fruit juices, Coca-Colas, any sports drinks, they all should be used in great moderation in these days, making sure that we don't get those white marks. So take care of yourself. I will see you on the other side.